Hi there. My name is Jill Jones, and I'm a consultant clinical psychologist in Fife. I'm really pleased to be able to talk to you today about implementing PBS in healthcare settings. I work in NHS Fife as part of the Learning Disability Services. So this is what I'm going to talk to you about today. I'm going to talk to you a bit about how we use PBS across our multidisciplinary teams. And I'm mainly going to talk to you today about adult settings. And this is because this is where my own clinical experience is from. We see across our child and family learning disability services that the use of PBS is growing. But for today, I'm just going to focus on adult settings. As part of this, I'm going to tell you a bit about the process for our PBS cases and some of the ways that we also add to our PBS documentation to enable implementation. I'm also going to talk to you about implementing PBS across our whole service, the kind of processes that we went through in order to get to the point of using PBS widely, some of the challenges that we've encountered in terms of using PBS and the benefits of using PBS in our service. And then lastly, I'm going to talk to you a bit about the service developments that we're making in order to kind of support the continued use of PBS in our services and with all of the individuals that we work with. So how PBS is used in our service. We are really lucky that PBS is used by all of our teams as a model which really helps us to make sense of and work together to reduce behaviours that challenge. In our service, this work tends to be led either by psychology colleagues or by colleagues in the additional support team who are all qualified nurses. And this has been because these are the professions in our service who have had most access to PBS training. Across our service, all of our staff have the opportunity to receive different levels of training and hence kind of contribute and understand and make sense of the PBS work that we do. So this is the kind of process that we follow. Similar to many teams, we receive a referral or a request for work related to behaviour that challenges. Now this can be from a range of sources, including our own partners within our own multidisciplinary teams, GPs, our social work colleagues, and from families themselves. Sometimes this work requests a PBS assessment, but often people get in touch to ask for help and advice in relation to behaviours that have become challenging. And we enter into the kind of initial phase of assessment. And obviously in this phase, what we're looking to do is collect data about the individual, the focus individual, make sense of their environment, think about the system in which they are, and work together with the people around the focus person to generate ideas around the behaviour and contribute to the overall PBS assessment. In the next stage, we develop a multi-element intervention plan, similar to the kind that Caroline referred to in her presentation. In this phase, we write a PBS assessment document which outlines all of the information that's being collected about the person, and we develop a PBS intervention plan. As part of this, sometimes we develop additional information to provide a kind of behaviourally defined how to do it guide for staff who might be working with an individual who's showing behaviour that challenges. This document, I'm going to show you this in a second, this can't ever replace any of the documentation from the PBS plan, and it needs to be read in conjunction with the PBS plan. But what it helps us to do is translate all of the kind of information that we have as part of the PBS assessment into a kind of practical how-to guide for staff who are kind of working day to day with the person. So a traffic light document might look like this. And what we're doing here is trying to help support staff and families make sense of the indicators that somebody is settled, give a clear idea about the kinds of communication, the kinds of structure and routine, sensory strategies, etc., that are likely to help this person stay in their kind of in their green phase when they're relaxed and calm. But what's really important to note is that some of the strategies that might work to keep somebody settled and relaxed are not the things that are effective when somebody has begun to move away from their own kind of baseline. So we call these the amber phase and the red phase, where we're moving towards or experiencing behaviour that challenges. And in these parts of the document, what we're sharing with staff and families is what kind of action is required by the people around the person in order to return them to a calm state. The last part of the traffic light document is the blue phase, the recovery stage, and this is where we are past any kind of difficult phase of behaviour, but still mindful that there could be a chance that behaviour that challenges may escalate. So understanding exactly what to do in this phase as well. So we find that using traffic light documents helps people to make sense of all of the information that's contained in a PBS plan and helps to translate it into a kind of practical, easy to read guide to help them know how best to support somebody. In the last phase of the PBS process, what we're doing is we're thinking about implementation, the kinds of changes that need to be made in order to improve things for the focus person. We are meeting with the team around the person in order to sense check all of this data that's been gathered. It may well be likely that we are continuing to gather data in order to measure the effectiveness of the interventions. And we're meeting together with people in order to review the interventions that have been suggested. So this implementation support may include coaching, it might include us reviewing data that's been collected, or we might hold meetings such as how's it going meetings or reflective practice sessions to enable staff or family members to have an opportunity to talk about how things are going and to help us think about whether any of the parts of the PBS plan need to be tweaked or amended. So moving on now to think about how we implemented PBS across our service. I think as with any sort of large-scale introduction of a new way of working, this can never happen overnight. And so our goal has been to use PBS as a predominant model and to make sure that we're all using PBS as a common language by which to make sense of behaviour that challenges. So all staff across the whole learning disability service can access awareness training, for example, NES improving practice, or in-house bespoke training packages that we develop in relation to specific cases that we work with. I think what we've tended, or what we've done over this time is that we've seen a kind of blending of approaches. As more staff have become trained in PBS and we've had more opportunities to use PBS in practice, we've sort of moved from using a kind of functional analysis approach to understanding behaviour towards using a PBS model, incorporating each of the sort of 4 elements that Anne referred to earlier in her presentation. And this is an ongoing process, but what's really positive is that the whole service has signed up to this and uses it as a way of thinking about and intervening with people whose behaviour challenges. So what can some of the challenges be in terms of using PBS? In my experience, PBS assessments can sometimes seem overwhelmingly long and complicated. And this is because obviously PBS aims to take a whole person approach, a holistic approach to understanding this person and the meaning of their behaviour in the context of their own life. What we're also asking people to do is often collect quite specific data in relation to when and how behaviour occurs. And sometimes we can seem like we're collecting an excessive amount of data in order to understand what's going on for this person. Because of these factors, it can seem as if only experts can do PBS assessments or plans. And I think that people can feel daunted about using PBS as a model. One of the things that Anne highlighted in her presentation earlier was the triangle, explaining that there are universal aspects of PBS that are important in all PBS cases. And there's much less awareness of these levels than there are of the specialist or intensive levels. One of the other difficulties of PBS is that it might only be asked for from our team when things have become extremely difficult for the person or for those around them. So this referral is made in a time when families or staff members are feeling extremely stressed and close to being burnt out. And the main aim of the referral is only to eliminate the behaviour. And this is tricky because clearly PBS has a much wider goal than simply eliminating behaviour. It's obviously about increasing quality of life, using the sort of values-led approach to understand behaviour and meet the needs of the person, and making the whole system work for that person. But because of this, these multi-element plans become more difficult to make sense of and implement. Families and support staff are the experts in relation to the person that they're supporting, and have often tried really hard to implement solutions or changes which they hope will have a positive impact for the person they're supporting. Unfortunately, when it's come to the point of referral, we know there isn't one simple, straightforward answer. There are a range of things that need to be implemented to support the person to show less frequent behaviour that challenges. But because of all of these factors, sometimes we're at risk of PBS being abandoned because the expert that's been called into this very stressful situation couldn't find the answer. However, despite the difficulties of PBS, there are many benefits. Firstly, the values base of PBS, increasing quality of life, is extremely attractive to most staff. Most people who work in services with people with learning disabilities are really in the job because we are looking to achieve this increase of quality of life for the people we're working with. So this makes it really attractive to staff. it's also really attractive to people who commission and develop services because of the growing evidence base in relation to the effectiveness of PBS in cases of behaviour that challenges. The fact that we carefully collect data allows us a real way of measuring behaviour change. And PBS generally feels like a really holistic and a better way to make sense of the people that we're working with. From my perspective, working in multidisciplinary teams, this work can really act as an umbrella to hold all the parts of the multidisciplinary work together. So what it helps us to do is really sense check the range of different interventions that different professionals might be considering against this information that we have about the person. And it helps us to make sense of whether these interventions are appropriate, whether they're appropriate right now, and whether they can happen in conjunction with other parts of an intervention. In our service, we're working towards improving some of the difficulties that I talked about earlier. One of the things that we're really trying quite hard to do is understand the demand in clearer detail. Not everybody who is referred to our service needs a full PBS assessment and plan. And in fact, many of the people referred to our service already have a PBS assessment and plan. For many people, what needs to be put in place are the factors which are documented in the universal or specialist parts of the triangle that Anne talked about earlier. And so our work really is about currently kind of trying to develop a coordinated multidisciplinary pathway for PBS. This will help us to support these universal elements and help the professionals in our team who can impact on these universal elements provide advice and support at the right time. We're hoping that this work will help us to direct our resources appropriately and really use the expertise across our service to its best effect. We continue to make sure that PBS is a predominant model in our service in terms of understanding how all the elements of somebody's life are linked up. But what we've also spent some time doing is making sure that PBS as a way of understanding things links with our other important service developments and ways that we make sense of people, for example, trauma-informed practice. So, in conclusion, PBS is a really helpful model which helps us to work with many quite seemingly disparate cases. PBS isn't a standalone intervention and integrates really well with other ways that we might be making sense of individuals and their experiences. My own thoughts are that the universal aspects of PBS are absolutely key to enabling us to successfully apply the intensive assessments and plans. And lastly, I'd suggest to everybody not to be daunted. PBS can seem like a big undertaking at the beginning of an assessment or when you're first starting to learn about it, but it's an extremely beneficial model for the people that we work with. So go ahead, give it a try. I hope you find it all useful. So that's all from me. Thanks very much for listening and hope to see some of you face to face in the future. Thanks very much. Bye.